Okay, ladies and gentlemen, now it's a big day. It's our first day in the OR, or this is maybe a repeat offender in the OR, but anyway, it's time to go to the OR. What do? We go to the front desk, we find out you need a locker to put your clothes in. I'm sorry to tell everybody, nobody gets their own locker. You have to share a locker. With the females share with the females and the males share with the males. They will give you the code to get into the locker at that time. I don't give it out anymore because we've had some thefts and different things, so I think it's best just when you come in that day to get that information from the front desk. Everybody, now, normally Patricia used to, and I don't know, so that's why I mentioned it, on your card, you used to be able to get 2 scrubs. I do not know if they are doing that any longer. If not, come to the front desk. We do have people that can get you scrubs. Okay, you'll go into the back, get your appropriate size scrubs and put them on. At that time, you'll put your hat on, and if necessary, you'll put your shoe covers on. You'll have removed all the necessary jewelry, put it on your necklace, like I said, or put it in your pocket. And if you've had nail polish on, that's something else I did not mention. I want to say, they say that nail polish, there's been different controversies about it, but I'm going to tell you, take it off. And if you do have fake nails, they used to say that was okay, but it really isn't, because a lot of times bacteria gets under those nails, so that really is not good to do so. Okay? So we've gone to the locker room, we've got our locker, we've dressed appropriately, we've come out to the front desk to see where our patient is. At this time, we do not have to have a mask on. We go ahead, we look at the front board, we locate our doctor and our patient. Of course, we're going to go in there, we're going to know all about the procedure that's being done because we've read up on it the night before. And we're going to go and see what our patient is having done. So the next thing I need to tell you is that, saying what goes on in Vegas stays in Vegas. What goes on in the operating room stays in the operating room. You can never, it's a HIPAA violation, you cannot mention that patient's name out in the hallway. You might say, I was in an interesting case today, we did blah, blah, blah. That's okay, but I keep that to a whisper. You never know who's standing around, because a family member could be in that elevator with you, knowing that their particular loved one is having a proctoscopy done or a hemicolectomy or something, and hear you talking about that, and they can get very upset. So, nothing leaves the OR. And having said that, one other very important thing I have to say, regardless what the residents and the doctors tell you, no medical students are taking pictures on their telephones. This was an incident that happened last year. I was not there at the time, but if I had been, those students would not have been invited back to the OR. We do not take pictures of any patients in the OR. I know the doctors say, well, this is for, this is for research or this is for education. Then let them take it on theirs. I'm telling you the correct thing to do. Do not take any pictures. And if they have a problem, say, well, you need to speak to Nancy because she has told us we are forbidden to take pictures. Okay? So we've located our room. Say we're going to do a liver resection with Dr. Slakey. So we go to room 14. We put our mask on. We go into the room. When you go into the room, you're going to see, of course, the table that the patient's on. You're going to see some people dressed in blue. Those, of course, your scrub tech in the sterile area. You're going to go up to them, and you're going to see a circulator who will be dressed like me, and just have a mask on and say, hi, my name is Robin. This is my first time scrubbing. Even if you scrubbed 5 times before, don't go walking in there. Oh, hi. Oh, yeah, like I've done this 100 times before. Because the minute you make a mistake, they're going to jump all over you. So go right in there and just say, hi, my name is Robin, and I'm going to be scrubbing with Dr. Slakey today. They're going to say, well, and then you ask, shall I get my gown and gloves? Now, if you've never been in the OR before, you don't know what size gown and gloves, what size gloves you wear. Normally for a female, the sizes go between 6 and 7. 6.5 is about the normal. For guys, it's between 7 and 8.5. 7.5 is about the normal. So if you've never scrubbed, kind of gauge yourself around that. Okay? If they say go and get your own gown and gloves, you're going to see something like this. This is what we call a C locker. It has on gowns, gloves, and anything that you need. You'll take one off the field, off this C locker. You're going to come down to the word gloves, pick out your gloves, and you're going to hand them to the circulator. If there's nobody helping, they want you to open them up yourself. I'm going to show you I'm going to just bring this over. If they ask you to, this is a table, we're going to say it's got all blue on it. Always remember when you're opening something sterile to open away from yourself. That's very important. Okay? So you see what I'm doing? I'm opening away from myself. Opening, and then I'm just tucking it all under so I get all pieces underneath, and I'm going to place it as close to the edge of the bed as a table as possible. Don't take this and go do this. This is not sterile, everybody. So as close to the edge of the table as possible, okay? And you're going to do the same thing with your gloves. Now, the thing I want to show you about gloves, there's been different people show different ways how to open gloves. What I'm going to show you, I think, is the easiest way to do it because you have complete control. And, all right, don't laugh, I know I can't get over. Okay, here we go. You've got complete control, and you're doing sterile to sterile. Some people, so what I do is I hold it like this. You know that this inside is sterile. I go just like this. Everything that is facing onto that table is sterile. If I take it, this is another way people do it. They'll open it, and they'll come over, and they'll flip it like this. That is really not a good way, but you've got to come way over like this to open that. So remember, always do it when you have, like I said again, you have a lot more control. Okay, so now we're ready to scrub.